Village Hopeco International welcomes you to Community Health Volunteer Training Module 4. Lesson 2, which covers reproductive health. And we have a few sections. Section 1 covers reproduction, 2 menstruation, and 3 family planning. Section 1, reproduction. Introduction. If we understand how our body works, then we can feel more comfortable in our own bodies, respect other people's bodies, control when to have a baby. Are you ready to go beyond taboo and empower yourself? This is the male reproductive system. Sperm carry the male's genetic information. Millions are released in each ejaculate. Only one is needed to fertilize one egg. Semen is the carrier fluid for sperm. It is released at ejaculation. This is often at the point of orgasm. The female reproductive system. We have the labia majora, labia minora, clitoris, urethra, vagina, and anus. The egg or the ova carries the female's genetic material. From menstruation, the women will produce 1 egg a month. Vaginal fluid released when aroused lubricates the vagina to help sperm travel and increase sexual pleasure. Intercourse. During intercourse, the man ejaculates inside the woman. If a condom or other barrier method is not used, millions of sperms are released into the vagina. Sperm then swim to the fallopian tube. Fertilization, 1 sperm joins with 1 egg. Implantation, fertilized egg moves to the uterus where it attaches. Here, the egg will try to grow into a baby. First signs of a pregnancy: a missed period, nausea and vomiting, sore or swollen breasts, tiredness, increased urination. If you think you or your partner is pregnant, take a test or see a healthcare provider. You will need support and prenatal care as soon as possible. Section 2, menstruation. Introduction. The periodic blood that flows as a discharge from the uterus. It's a natural process, but if not properly managed, it can result in health problems. When it occurs, begins when a girl is between 12 and 15 years old. Every 28 days and lasts for 3 to 5 days. 1 egg released. How it occurs? 1 egg released every month. This is called ovulation. Before ovulation, the uterus prepares a soft tissue lining, like a nest, to home a fertilized egg. Most times, the egg is not fertilized by sperm, so the egg breaks down. The soft lining is therefore not needed, so it is shed. It flows out of the body as menstruation. How it occurs? You can see the thick lining of uterus. Thick lining grows in uterus to receive fertilized egg. Thick lining of uterus breaks down. Bleeding occurs. If egg is not fertilized, uterus lining breaks down, leading to bleeding. Effects: you feel tired, have pain in lower abdomen and back, have sore breasts, feel your body swollen with water, have more pimples, feel more emotional. Facts about menstruation. Menstruation happens to all women. It is not dirty. It is not an illness. It is normal. There is nothing you cannot do while menstruating. It does not stop you from living your life normally. Problems with menstruation: painful menstruation. Some girls have abdominal pain before or during their monthly periods. Painkillers give at the given at the health facility. Losing a lot of blood. Some girls lose a lot of blood and the periods last for 6 to 10 days. The patient should be referred to the health facility if this continues for a long time. Losing blood between periods. A woman who loses blood from the vagina between her regular monthly periods should be referred to the health facility. Irregular periods. In some girls, the time between period varies, may be shorter 3 weeks or longer 6 to 10 weeks. No treatment is needed. How to stay healthy during periods. Practice good hygiene, deep breathing. Going for a short walk will help with your cramps. A heat pack bottle can ease stomach and back aches. Use a clean sanitary pad. Try to eat some dark meat, beans, and green vegetables for iron that will help make new blood. Only use painkillers and pills. If nothing else works, self-care during menstruation. Girls should wear a clean pad to soak up the blood. Make sanitary pads from locally available materials with a plastic sheet underneath to prevent leakage. Install hand washing station in changing areas and latrines. Wash hands with soap and running water. After handling blood, stained materials or caring for patients. Wear gloves or plastic bags when caring for sick persons with menses. For reusable materials, soak in soap and water for 20 minutes. Once a female's relation to pregnancy. Once a female starts to menstruate, it is a sign she is fertile, able to get pregnant. Periods happen when a woman is not pregnant. It is the loss of an egg and womb lining. Pregnancy occurs when an egg is fertilized by a sperm, then it grows in the womb. If this happens, periods will stop. Family planning, section 3. Family planning is planning intended to determine the number and spacing of one's children through birth control. Child spacing, practice of waiting between pregnancies. A woman's body benefits from rest between pregnancies. After having a baby, it's a good idea to wait at least 18 months before getting pregnant again to maintain the best health for her body and her children. Types of contraceptives: intrauterine device, IUD, contraceptive implants, oral contraceptive pills, injectable contraceptives, female condom, and male condom. Intrauterine device, small plastic coil fitted into a woman's uterus. It can be hormonal or non-hormonal. Requires healthcare provider to insert. Does not prevent against HIV/AIDS and other STIs. Requires removal for a woman to become pregnant. Prevents pregnancy for up to 12 years. Implants. Requires healthcare provider to insert. Does not prevent against HIV/AIDS or other STIs. Requires removal to be pregnant. Mother may experience side effects such as bleeding and lower abdominal pains, but can be managed at the health facility. Implants, matchstick size rods, 4 centimeters long, inserted under the skin. It's implanted mainly in the arm. Contains progestin only. Can be 1 implanon, 3-year plan, or 2 Jadel, 5-year plan. Oral pills contain hormones to prevent eggs from growing. They can reduce menstrual pain and bleeding. Must be taken daily to effective. If you forget to take your pill, take it immediately you remember and continue with the schedule. If you remember the following day, just a few hours to the normal time you take the pills, take the 2 pills. Pills may have side effects. They do not prevent against STIs and HIV. Injectable contraceptives, they contain hormones, prevents pregnancies for 90 days, does not require daily use, requires repeat injection after 3 months, does not prevent against HIV, AIDS, or other STIs, may have side effects. Female condom, a plastic pouch inserted into the vagina before sex, provides protection against STIs and HIV, must use for every sexual act, requires partner cooperation. The male condom, a thin latex tube that is rolled over the penis, effective if used correctly, provides protection against STIs and HIV, must be used with every sexual act, should not be reused, requires partner cooperation. Always how to use a male condom correctly. Always check the expiration date, date of manufacture on the condom wrapper or package. Discard if out of date. Take the condom out of the wrapper, making sure not to damage the rubber with your fingernails, teeth, jewelry when opening the package. Hold the top of the condom and squeeze out the air at the tip, leaving room at the tip for the semen. Put the condom on when the penis is erect, but before it has come into contact with partners, genitals, or mouth. Roll the condom all the way to the base of the erect penis. After ejaculation, withdraw the penis immediately before erection is lost, holding the rim of the condom to prevent spilling. Tie a knot in the condom and dispose safely. Natural non-medical methods: abstaining, voluntary abstaining from sex, prevents STIs and HIV, requires commitment. Lactational amenorrhea method, LAM, mother exclusively breastfeeds her child during the first 6 months. Need to feed frequently during the day and especially during the night, more than 8 times. Effective if mother has no monthly bleeding and if used with another method such as a condom. Does not prevent against STIs and HIV. Cycle beads, fertility awareness based family planning method. Identifies a fixed fertile window for women with cycles that are between 26 and 32 days long. For women with cycles in this range, the method identifies days 8 through 19 as potentially fertile days. A user simply tracks the start date of her period and the days of her cycle to know if she's on a day when pregnancy is possible or not.